So again, we are going to go very fast through this session. We are basically having two sessions. We are going to look at evidence-based practice and a culture of inquiry, and then we shall look at what we term as the Picot question. Or basically, we shall have a session on how to formulate a research question, because definitely when you are implementing evidence-based practice, you have to come up with questions that you will need to answer. So how you often answer those questions can depend on whether you're going to read the literature and decide on the best course of action, or you might actually have to carry out research. Okay, but regardless of the direction that you will take, you still need to have a very good question. So how do you formulate a question? That will be session number 2. So session number 1, our interest is on understanding how you can have a habit of always questioning things, such that you can go and look for the right evidence that you can apply. So the whole idea is that in the health sector, you are met with different situations that require you to make decisions. And these decisions are often in the best interest of the patient. Together, of course, with the facility or the institution or the health facility where you're providing this care in. So you need to make sure that the decisions are evidence-based, such that you can have quality, safe, effective, and efficient care. So if you don't use evidence, most likely you have a decline in the quality of care, and this will be manifested through the poor patient outcomes. And then, of course, the resources will not be utilized well, so you have an increase in the costs. So that means that if you use evidence, it's actually better for the organization, because it will reduce the costs eventually. Okay, so that means that for you to be able to provide this quality care, you should have a mindset of always asking what is the best, what is the best evidence that we can have, or what is the best course of action to be taken that is backed by evidence. That is very, very important. So that means that you need to always have a culture of clinical inquiry. You need to have clinical inquiry skills, that you always need to ask yourself questions when you're providing care. Okay, and also the theme that we have been relaying over and over again is that you need a supportive environment for you to be able to practice evidence-based care. And the supportive environment is created through having the top management supporting this kind of culture, and therefore ensuring that you have the resources that will promote this culture of applying evidence-based care. So in institutions that have this culture, you will have a library with books, you will have internet, you will have subscriptions to journals, you will also have, in most cases, you will have a committee on quality improvement. And then you also have policies on continuous professional development. So there are a number of organizational factors that will promote this culture of evidence-based practice. So at a personal level, you need to have that mindset of always reflecting about the care that you always provide, and in the healthcare setting. That means that you need to reflectively think about the care that you have provided in the past, or even the care that you're providing at a particular moment in time. So that mindset is very important, because you don't take things the way they are, but you always have to ask questions. You have to interrogate assumptions. You have to question norms, such that at the end, when you are repeating a particular procedure, you are repeating it when you have it being backed by evidence. Okay, so this is important for learning purposes. It's important that you have also evidence-based decisions that you're making. Now, that mindset is different from research, but they are also related, because one mindset can lead to the other. If you have a mindset of always asking yourself questions, in most cases you'll be good at utilizing research, but also conducting research. So the questions that you always have can be coming from research. Okay, when you read research articles, you have questions that you think are not addressed well by the research that is in a particular area. So most likely you will conduct your own research. Okay, so this mindset of always questioning can lead to research, but itself is not research as such, because when you have this mindset of questioning things, you might actually go into the library and look for evidence, and then you understand what evidence is there and what can you apply and what maybe may not be applicable in your context. So when you do that, that is that mindset. Then now when you systematically carry out research, because you have picked interest through your mindset and your literature review, that is something also quite different. So inquiry is related to research, but it is not research in itself. So you should have that mindset of always asking. You need to be curious. Curiosity should be part of you. And then reflection, that if you have provided care to a patient, you, after some time, you may have to reflect upon your action, your reactions, everything that was around that kind of situation. And then you make a judgment on whether perhaps what you did was actually right, or there are some areas that you actually need to improve on. And that is what we call reflection. Okay, you need to question the things that you do. Whether you are providing care to someone as a patient, or whether you are evaluating how you interacted with people, everything, reflection is actually very important. It's one of the ways in which you can learn about yourself, but it's also one of the ways in which you can basically improve your interpersonal relations. Okay? So inquiry is not a project, it's a trend, it's a lifestyle. It's like it's something that should be ingrained in you, and it's basically the basis of what we term as evidence. I mean, long life learning. You are a long life learner. Okay, so you learn every day. You can only learn every day if you understand that things will always keep changing, and perhaps what you're doing is not the best. If you have the assumption in your mind that what you already have in your mind is sufficient, then you never have that mindset of always looking for something that is actually new, that you don't know. Okay, so it's very important at individual level that you have that kind of mindset, but also the whole organization should have that kind of culture. That is when you have what you call same is, okay, continuous medical education for everyone. whether it is nurses, clinical officers, doctors, consultants, they will always come and attend these sessions because they want to basically continuously learn and improve themselves and improve the care that they always give. So don't always follow people blindly, and don't always have this mindset, but this is how we have always been doing it. No, that mindset is not the right one. The right mindset is that you need to always question. Critical questions, critical thinking skills, and also reflection are very important. Why? Because the healthcare industry is not static, it keeps changing every day. It's dynamic. You need to be very adaptive to these changes that happen, and also new evidence is always produced, and healthcare is driven by evidence. So what do you always need to have? One is that you need to have a mindset of always seeking for clarifications. If you don't know how certain things are supposed to be done, or why certain things are done the way they are done, that is very important. Secondly, you need to be a very good person in formulating questions. If you don't have the right questions, actually intelligence sometimes is manifested in the kind of questions that you ask. So you need to ask critical questions, questions that provoke the mind. So you need to be very good at that. And then when you develop these very good questions, it is possible that you can get the right answers if you go and do literature review or critically observe individuals or even interview people. You always get the right answers. Okay? So we expect that if you have that mindset of always asking the most important questions, then it means that you'll be a good user of research and as well as a good producer of research, because you are very critical. You interrogate, you don't just take information on the surface. You analyze what evidence we are having, you analyze what people are doing, and then you're also very good at implementing some of these things that you actually see, the evidence that you have, and then be able to evaluate whether there is an improvement or not. Okay, so if you have an organization that you're working for, it should have the following to manifest that actually for the institution is actually promoting inquiry-based healthcare. One is that the institution itself and its social influences actually impact on what people do on the ward. Some of the things that actually manifest show that it's a culture that promotes excellence and quality care is when there is a reward system for people who are very good at using the latest evidence, people who can challenge systems, who can challenge practices. If there is a very good reward system within the health facility, it is a manifestation that they are providing inquiry-based healthcare. Okay, and then the institution should be able to value what we term as explicit and implicit knowledge. This is also something that we shall look at shortly. But knowledge, there is knowledge that is taught to you, and but there is knowledge that is very hard to even transfer. But it's also very important in healthcare. So explicit is that knowledge that you say, okay, this is how we do something. But implicit knowledge is knowledge that is very hard to transfer. Okay, and we shall look at an example in that regard. Okay, so implicit knowledge that is hard to transfer and express, but is equally very important. You can go to a hospital and then a nurse who perhaps is an enrolled nurse is very good at cannulation compared to a nurse who has a master's. What's the difference? The difference is that this nurse who has a certificate in nursing is actually is having implicit knowledge, that knowledge that they have gained as a result of experience. So they know where the vein is, and they will always go there, even if they have just done just a small wipe, they will see where it is. And then for you, you will not see. So you will be there asking yourself, how did this person locate the vein that is not actually visible? So for you, you are a new graduate, you don't have this experience, but you know the knowledge of how a vein can be located. So you have that knowledge. So it means for you, you know that you can use strong light. If you tie the vein, the hand very well tightly, the veins may actually be visible, and you actually know the location, anatomical locations, by theory, but in practice you might not actually be knowing uh, where this vein is and how can you make it very prominent and easy. At what angle can you place that cannula when you are inserting it? So that's the difference: explicit knowledge and implicit knowledge. Sometimes we say that implicit knowledge is what we term as tacit knowledge. Okay, tacit knowledge. So another example here is that we can teach you how to take a blood pressure. So you know the systolic and the diastolic, you know how to inflate the cuff and things like that. So we teach you this procedure and you know how to do it. But the implicit knowledge comes in if there is a patient who has come and is very sick, and perhaps the most important vital sign to take at that particular moment is actually the blood pressure. So it is the nurse who is well experienced who can basically do say, please let us first take the blood pressure, and perhaps this nurse might have made that decision to take the blood pressure because the nurse is saying that this patient is perhaps let us say is an elderly patient, and most likely blood pressure would have gone up. And indeed, when you take the blood pressure is actually very high. And then for you, perhaps as a novice, as a new person in the profession, you think we need to take the what? We need to first take the temperature. We need to first take a urine sample, whatever it is. Okay, but this express person will tell you no, that person's blood sugar has gone up. Let us first test this. Okay, so you go direct for random blood sugars before any other thing. So that's the difference between the knowledge that you get in school and the experience, the knowledge that you gain through experience. Okay, so reflection is one of the most important things, and I've overemphasized this. You just need to know the moments at which moments at which you can actually do reflect. Okay, reflection on action, reflection for action, or reflection in action. Regardless of what you can do, they are all very important. Okay, so application. You see, this inquiry mindset is very important at a personal level for your growth, but also for how you can solve day-to-day problems. You see, these things that we actually learn, they do not only apply in patient care, they apply in how you navigate the daily challenges that can allow you to move forward in your profession. Okay, so you need to make that commitment that you need to develop this inquiry kind of mindset or culture such that you can progress in your career. So that means that you should be good at reading, because reading actually solves a number of things in your professional life. Evaluation of information or literature. So that means that you need to be very good at critical reading. You don't just read to absorb information, but you critically evaluate the information that you read and determine whether it is information that is worthy even applying anywhere. Okay, so that's very important. Um, so the things that perhaps you need to be engaged in that can encourage that culture of inquiry is that you engage in debate, engage in discussions, always question assumptions, uh, reject dogmatism. Please reject and reject rigidity. Be open. I think one of the skills that you actually need in this generation is being open-minded. It's one very important. Actually, being open-minded and also being open to learning. Uh, those are two very important skills. You, uh, because one supports the other. If you are not open, you cannot learn. But also with learning, we are talking about unlearning, relearning, and learning. Okay. Those are different terminologies. So you need to be able to unlearn. You need to have you the things that perhaps worked some days or some years may not be the things that are actually working now. So that means that you actually need to unlearn. Or sometimes you might have learned something, but you didn't learn it the right way. So you relearn. Okay, so those are very important aspects. Um, of course, openness, um, trust is also very important. Providing a voice for all participants. All these allow you to learn from all people. Okay, if you respect people's opinions, you are tolerant to diverging opinion. That is actually very, very good. Okay, so if you're working in a health facility, if you have very good culture on or culture of inquiry, uh, most likely you always base your decisions on the best available evidence, and therefore you will apply this evidence in your clinical practice. And overall, your decisions, you make responsible and accountable decisions. Okay, those two things are very important. When you make a decision, you need to own it up, and you should be accountable for the decisions that you make. And if you base your decisions on evidence, then that is actually better. Okay, and we earlier on emphasized the fact that organizations are very important in supporting this inquiry. Building communities that encourage inquiry is also very important. People within the organization, if the mindset of the people, the staff, it's about they don't say so and so is always asking questions, and if you have that kind of situation in a workplace, then you have a problem. It's going to be very difficult to apply evidence-based practice. Okay, some people actually, you see, this training that you are having on how to use evidence, this training is not available to everyone. And it's possible that uh, someone can go through campus and they have never had this kind of session. So they lack the capacity to apply evidence. So when institutions actually take deliberate steps to make sure that people are actually taught on how to use evidence in their practice, then it actually becomes very important. And usually for such institutions, there is alignment with, in terms of budgetary allocation, in terms of policies, in terms of reward systems. This always have to work together to make sure that you have that culture and a community a community of inquiry where you have people embracing new knowledge and evidence and applying it. Okay. But the barriers are if you don't have, if there is no reward. I think the most important thing for me here is reward. If the organization or if the environment is not rewarding for the use of evidence and provision of quality healthcare, then you're going to have people being reluctant to go and read, even if you give them apps on the phone, even if you have guidelines in the hospital, they will not use these things and they will not even go for further studies to make sure that they actually get the latest knowledge. Okay, so those are usually the challenges. People are comfortable where they are. they don't want to read. So there is no reward for using the latest evidence in care. If that is the situation that you have, then you have a poor culture in terms of inquiry. Okay, so uh, what you need to do to foster that kind of mindset in health facilities or in the healthcare setting is you enforce you foster that culture, you promote and embrace that culture of inquiry. You should value and trust the process of evidence-based practice, and then also I think people need to be trained on these things. People need to be trained. You see, you need to be trained on how to locate evidence and how to apply. These these look like minor skills, but they're actually very important, and they can be strong barriers to evidence-based practice.